The World Health Organization declared the ongoing Mpox outbreak in Africa a global health emergency on Wednesday, August 14, 2024. This is the highest level of alert under international health law. This announcement follows a similar declaration by the African Centers for Disease Control and Prevention on Tuesday, August 13, 2024. A more lethal strain of the virus, clade 1b, is rapidly spreading in the Democratic Republic of Congo and has reached at least 4 African countries. The risk of further international spread is very worrying, said WHO Director General Tedros Adhanom Ghebreyesus. Medical experts worldwide are closely monitoring the situation. What is Mpox? Mpox, formerly known as monkeypox, is a viral disease related to the now eradicated smallpox virus. It spreads through close contact such as touching, kissing, or sex, and through contaminated materials like sheets, clothing, and needles, according to WHO. Initial symptoms include flu-like signs such as fever, chills, exhaustion, headache, and muscle weakness, followed by a painful or itchy rash with raised lesions that scab over and heal in few weeks. What is different about this outbreak? Mpox is characterized by 2 genetic clades, 1 and 2. A clade is a broad grouping of viruses with distinct genetic and clinical differences. Clade 2 caused a global outbreak and declared a global health emergency from July 2022 to May 2023. The current outbreak is driven by clade 1, which causes more severe disease. The subtype clade 1b responsible for most of the ongoing spread is relatively new. Clade 1b has emerged as a new mutation adapted to humans, said Dr. Daniel Bosch, the Senior Advisor for Global Health Security at the Foundation for Innovative New Diagnosis. The virus often transmits from animals to humans, but once a mutation adapts, it can be transmitted by humans and drive larger outbreaks. Multiple overlapping outbreaks compound the current situation. How dangerous is it? Some clade 1 Mpox outbreaks have killed up to 10% of those infected, though more recent outbreaks have had lower death rates, according to the US Centers for Disease Control and Prevention. The fatality rate for clade 2 is less than 0.2%. Certain groups, including infants, people with severely weakened immune system, and pregnant women, are more likely to have severe infections. The surveillance of Mpox is incomplete, leaving much to learn from, Bosch said. We lack proper diagnosis, especially in rural areas where most cases are seen, he noted. Understanding transmissibility and fatality risks may be skewed by detecting only the most severe cases. Regardless, increased spread raises the public health burden and affects more individuals. Mpox causes significant pain, suffering, fear, and panic, Bosch said. Where is it found? For decades, Mpox was mostly found in Central and West Africa. Most clade 1 cases were in Central Africa and the Democratic Republic of Congo, while clade 2 cases were mainly in Nigeria. In 2022, concern grew when cases spread to Europe and North America. Broader international spread is a key reason for global health emergency declaration. The current outbreak's geographical pattern differs from that of 2 years ago. Mpox is now reaching more previously unaffected African countries. While most cases remain in the Democratic Republic of Congo, at least 13 countries across the continent have reported cases according to the African Centers for Disease Control and Prevention. On Thursday, Sweden confirmed its first clade 1 Mpox case, making its first appearance outside Africa. With international travel, no one is safe until everyone is safe, Bosch said. There are many reasons to be concerned and act early. Equity and human rights are also important. The Global Health Emergency Declaration from 2022 set a precedent, and similarly, concerning patterns of transmission across multiple African countries deserve as much urgency as spread in high-income countries. How can the spread be contained? Mpox vaccines are available but not widely accessible in Africa. No clade 1 Mpox cases have been identified in the United States, but the US Center for Disease Control recommended last week that people exposed to or at high risk of catching Mpox should get vaccinated. The Vaccine Alliance, Gavi, has up to $500 million to supply Mpox vaccines to affected countries, including the Democratic Republic of Congo and surrounding areas. By 2026, Gavi will establish a global stockpile of Mpox vaccines, similar to stockpiles for cholera, Ebola, meningitis, and yellow fever, according to a news release on Thursday. However, WHO emphasized that vaccines are only part of the response. Containing the spread also requires increased surveillance, diagnostics, and research to fill in the understanding. WHO has signed off on the emergency use list process for Mpox vaccines and developed a regional response plan needing $15 million with $1.5 million released from the WHO contingency funds for emergencies. 500,000 vaccine doses are in stock, and other 2.4 million could be produced by the end of the year, according to Team Hungarian, the WHO Health Emergencies Program. Dr. Abodu Salam Guyen, Director for the African Regional Emergency, has said that the Democratic Republic of Congo and Nigeria will be the first to receive the vaccines. WHO Director General addresses media on Mpox 2024 surge after Emergency Committee meeting, August 14, 2024. Let's watch.
Good morning, good afternoon, and good evening. Mpox has been reported in the Democratic Republic of the Congo for more than a decade, and the number of cases reported each year has increased steadily over that period. Last year, reported cases increased significantly, and already the number of cases reported so far this year has exceeded last year's total, with more than 14,000 cases and 524 deaths. As many of you who tune into our regular press conferences know, WHO has been working on the Mpox outbreak in Africa and raising the alarm that this is something that should concern us all. Last week, I announced that I was convening an emergency committee under the international health regulations to evaluate the upsurge of Mpox in the Democratic Republic of the Congo and other countries in Africa. Today, the emergency committee met and advised me that, in its view, the situation constitutes a public health emergency of international concern. I have accepted that advice. The detection and rapid spread of a new clade of Mpox in eastern DRC, its detection in neighboring countries that had not previously reported Mpox, and the potential for further spread within Africa and beyond is very worrying. In addition to other outbreaks of other clades of Mpox in other parts of Africa, it's clear that a coordinated international response is essential to stop these outbreaks and save lives. A public health emergency of international concern is the highest level of alarm under international health law. The emergency committee's advice to me and that of the African CDC Centers for Disease Control and Prevention, which yesterday declared a public health emergency of regional security, are aligned. WHO is on the ground, working with the affected countries and others at risk through our country and regional offices, as well as with partners including the Africa CDC, NGOs, civil society, and more. For example, we're providing missions to analyze blood samples and confirm cases of Mpox. We're supporting laboratories to sequence viral samples. We're on the ground supporting case investigation and contact tracing, risk communication, and community engagement. We're training health workers and supporting clinicians to provide appropriate care. We're supporting countries to access vaccines and develop the strategies to roll them out, and much more. To fund this work, WHO has developed a regional response plan requiring an initial $15 million. We have released about $1.5 million from the WHO Contingency Fund for emergencies, and we plan to release more in the coming days. We're also appealing to donors to fund the rest of the response plan.
The Mpox outbreak in Nigeria. The Nigeria Center for Disease Control and Prevention, NCDC, has confirmed 39 cases of Mpox in the country. The agency stated that no deaths has been recorded from the diseases so far, and that the cases were found in 33 states and the Federal Capital Territory, FCT. Dr. Jide Idris, the Director General of NCDC, shared this information at a press conference in Abuja on Thursday evening. He provided updates on the ongoing outbreak of cholera, Mpox, and other public health issues. This announcement follows the declaration of Mpox as a public health emergency of international and continental concern by both the WHO and the African Centers for Disease and Prevention, ACDC. Idris reported that Bayelsa has the highest number of confirmed cases, with 5, followed by Cross River, Ogun State, and Lagos State, each with 4 confirmed cases. This press conference aims to strengthen our coordination and communication with stakeholders to manage the spread of the virus and prevent cross-border transmission.